Be our next. Our topic is After the Pandemic, Defining the New Normal. Dr. Hopkins earned her doctoral degree and completed her postdoctoral training at the University of Louisville. She completed her internship in child and family psychology at the Southern Arizona Psychology Internship Consortium in Tucson, Arizona. In our current role, Dr. Hopkins treats pediatric patients in primary care while leading the efforts to integrate behavioral health into general pediatrics with Norton Children's Medical Group. Prior to joining this, she was an assistant clinical professor of counseling psychology at U of L, where she served as the director of 2 community-based behavioral health training clinics in West Louisville, known as the Cardinal Success Program, serving individuals and families across the lifespan. Welcome, Dr. Hopkins.
Hi, good morning or good afternoon at this point. I'm so excited to be here. I'm going to go ahead and share my screen. So let's see. And let me know if you're able to see that.
We can see your screen, but we cannot see you anymore.
You can't see the, okay.
No, we could see the screen, but not you.
Oh, okay. Sorry. I've not had that happen before. So let me see if I can. Here we go. Any better or no?
Yeah, it's good. You just hit something.
Oh, I just did something that worked. Well, that's, can you see me now?
We can see the screen, which is good.
Okay, so it's okay if you don't see me, as long as you can hear me and see my PowerPoint.
Perfect.
Is that okay?
Yes.
All right, so thank you so much, everybody, for joining me this afternoon. Later in the day, I know that after a long day of fantastic presentations, I hope that what we can talk about today energizes all of you as you help your patients and perhaps your own families get back on track maybe after such a remarkable year. When the CME department at Norton reached out to me about presenting at the Just for Kids Symposium, they had suggested the title of this presentation to be After the Pandemic, Getting Back to Normal. And, you know, I suggested that we really approach this from a different direction, and that I'm not sure that I've met many people who are quite wanting or ready or ever want to return to what was normal pre-2020. I think that this past year has really offered us an opportunity to rethink how we want our lives to be moving forward. And I hope that I can offer some suggestions about how you can help your patients kind of consider those things as they perhaps reintegrate into some activities that they've done before, but with a new perspective. So I have no relationships to disclose. Okay, so the things that we're going to talk about today, and I'm going to do so as quickly as possible, is very quickly, I'm going to go over the common behavioral health issues pediatricians were seeing in kids in their practices pre-COVID versus during the pandemic, and now as we hopefully see the horizon of the end of the pandemic. What providers can do to help patients and families manage the stress of re-engagement in activities, and what steps to take if further evaluation and treatment is needed. So let's talk very quickly about the state of pediatric behavioral and mental health in primary care. Many of you, as you see these numbers, these will not be surprising to you, given your own experience with patients in clinic. Approximately 20% of kids met the criteria for a mental health disorder. 75% of those children were seen by their primary care provider, but only about 50% of those children receive any mental health treatment. 35% of child mental health issues are managed solely by pediatricians, 26% by psychiatrists, 15% by psychologists, and 24% by some combination of a mental health provider and primary care physician. 10% of kids have mental health issues that severely affect their daily functioning, and 80% of that 10% never receive any mental health services at all. And quite startling, 50% of parents that have children with emotional, behavioral, or developmental concerns did not even bring this up with their child's doctor. So during COVID-19, of course, we are trying to gather these numbers as rapidly as they come out, but I suspect that in the coming year or so, we'll have even more accurate data about what these numbers look like and the impact of mental health on kids during COVID-19. But we do know that mental health visits were up significantly in pediatric emergency departments in 2020 compared to 2019. We saw higher acuity and higher levels of anxiety and depression, significantly higher rates of suicide-related behavior, increased rates of domestic violence and child abuse, and increased rates of food insecurity, poverty, and homelessness. COVID-19, of course, only further pulled back the curtain on health disparities and inequities. Communities of color were disproportionately impacted by COVID-19, which was reinforced by structural racism. We saw increased racism and xenophobia against Chinese American and other Asian American communities. Many displaced families, either houseless families or families that were in transition, were at increased risk of developing behavioral health concerns. And then LGBTQ youth, who have always been at increased risk for mental health issues if parented or in families that are unsupportive. Many of these youth were at home during this time with those families, and they may have been at increased risk if living at home with families not giving them the support that they need. Other exacerbating factors where we saw a lot of kids struggling, temperamental style. So children who were less flexible tended to not fare as well with the change. Of course, parent and caregiver stress, family separation, community separation. So being disconnected from the natural supports of the community, grief and loss related to missed milestones, transitions and rituals, in addition to grief and loss from losing family members and loved ones. And then, of course, pre-existing special health care and or educational needs. Kids that were impacted by all of these were at increased risk of developing mental health issues during the past year. So now what are we looking at and what am I seeing in my own practice? I see about 600 kids a year referred to me through primary care and specialty care clinics with Norton Children's Medical Group. In my practice, and we're seeing this kind of nationally as the data emerges about how kids are, what kids are presenting with as they transition back into their activities, back into social settings, back into school. We're seeing increased traumatic stress symptoms and adjustment difficulties, increased anxiety, difficulty reestablishing routine. And then I think maybe some of us can really relate to this, a resistance to going back to a busier or more active schedule. While we really don't have excellent data yet on the lasting impact of COVID-19 on kids and adolescents, I really have noticed that I'm seeing a steady stream of anxious kids, particularly in my practice. Social anxiety, anxiety about getting COVID, anxiety about returning to prior productivity levels, or just wanting to avoid returning to kind of that old version of themselves, those kids returning to maybe social or peer groups in which they had a lot of concerns or peer related conflicts, and having anxiety about returning to that. If we think about COVID and the year and what it took to stay safe from COVID, it really required a baseline of anxiety. Anxiety, when it's adaptive, asks for us to plan, prepare, and pay attention. And if you think about what we were asking our children to do during that time, it was stay away from others outside of our family members, make sure that we're washing our hands, make sure that we're always wearing a mask. And this was really about safety and well-being. And there were messages everywhere that if we didn't take these steps, we might get sick or we might get a family member sick. And so kids and families really had to rely on a baseline of anxiety to maintain those rules. And now that we're asking them to let those go, and in some cases for children under the age of 12 who haven't been vaccinated yet, it's understandable that kids and adolescents have some anxiety about all of a sudden, seemingly overnight, needing to no longer use those strategies or have that anxiety in order to keep themselves healthy. So what can primary care physicians do? How can you help your patients and families manage stress as we resume pre-COVID activities? So there's a number of different ways that you can support patients and parents. And the first thing that you can do is start with assessment. So you want to evaluate the impact of this past year and the impact of returning to kind of pre-COVID activities. So first, always inquiring about children's mental health and behavior and development. There are some standardized measures you can use, but also just using the check-ins during the well child check or sick visits, checking in about how they're doing and their well-being is just, a good place to start. Always making sure that you're assessing for social determinants of health, including food security, housing, internet connectivity, access to childcare, employment status of the family, racism and other forms of discrimination, and adverse childhood experiences all can really give you as a provider a good sense of how your patient is managing during this time. It's important not to overlook parental and caregiver well-being. And so you can do that through screening for postpartum depression and intimate partner violence. Many of you already do that in some of your well child checks. And then checking in about their own emotional reactions and availability of natural supports. We know that the well-being of parents is essential for the well-being of kids. And so if we're overlooking parent caregiver well-being and just jumping straight into solutions for kiddos, we're missing a huge part of what's going to be a kind of foundational step in order to make sure that kids are headed in the right direction. So there's a number of things that you can do when you find, as you discuss with families and kids about helping to ease the stress of re-engagement. Emphasizing the importance of daily structure and routines as families start to include more and more activity. Reestablishing a routine, even though it's summer, routines are still very important. And then of course, when they get back into school, making sure that there's a good routine going and getting used to the new family rhythm. It might help to limit, to help families kind of start to limit or temper their personal expectations for how quickly things are going to go again back to normal. Prioritizing these important healthy lifestyle aspects is going to be really important for families as they get back into a routine. So making sure that they are focusing on the important things like adequate sleep, healthy eating, organized structure around schoolwork, and then also making time and scheduling time for unstructured and consistent time with friends and family. The importance of routine and healthy lifestyle maintenance cannot be overemphasized. If kids aren't getting enough sleep, if they're not eating regularly or moving their bodies, they're not going to have the foundation needed for healthy coping. This is the, when I have kids that come in to see me, in my intake, I'm assessing for their lifestyle. And if I hear that they don't have a lot of structure, or don't have kind of these key components as a foundation, that's where I begin. I'm not going to jump in with cognitive behavioral skills for anxiety before I make sure that they're getting good sleep and eating on a regular basis. It's important that you really spend time to validate the importance of good caregiving for kids as they manage their stress of going back to the life that they had before. So emphasizing the key role that parents and caregivers have in supporting healthy development and helping them understand that parental well-being impacts child well-being. So what can parents and caregivers do? What are things that you can offer or suggest to parents and caregivers to help their kids manage the stress of going back to school, going back to their activities? So the first thing that we need to do is make sure that in order to tame that stress, we have to name it. So name it to tame it. So while a lot of families may feel rushed to get back to the way things were, it's important that we take time to acknowledge the way things are and the way things that they have just been. So a lot of times I work with families that are really wanting to just ignore the impact of this past year on everyone's well-being. But I think it's important that families spend some time acknowledging with their kids the grief and loss of this past year, the uncertainty and persistent anxiety that I talked about, the languishing that we all experienced, or that many of us experienced with just things not really having anything to look forward to for a long period of time, really having to manage our expectations or let go of expectations, not being able to plan for the future for a long period. But I also think it's important that we not overlook the joy and the new connections and the respite that many of our families experienced in this past year that may be informing some of their anxiety to again, go back to normal. This past year has been so many things to us. And, I think it's important that we acknowledge all of the range of experiences and responses that families have had. Even within families, we can have children, different children have had different experiences as we have had different experiences. So validating children and adolescents, many different feelings over this past year, as well as how they feel as they look forward to the future, is an essential first step in moving forward. So, families may find that, this pandemic has provided an opportunity to reevaluate priorities, and the limited activities over the past year perhaps provided a welcome respite. So I really like these questions. So psychologist and relationship expert Esther Perel has these great set of questions that we can ask ourselves and ask kids and teenagers as we prepare ourselves to think about what do we want to bring back into our lives as we emerge from this past year. So having a sit down discussion with kids and teenagers and ourselves, what do we want to go back to? What have we missed? What do you appreciate? What have you appreciated over this past year that you want to hold on to? What do you hope won't change about what happened to you? So what are the things, how are the ways in which kids, adolescents, parents have changed? Because certainly this year has changed us all, that you want to keep. And then also importantly, what do you want to do differently as you go back? And I think that it's important that these questions really be asked thoughtfully. And I think that these are some great prompts for families that you could offer to them as they are trying to figure out how to reprioritize and rearrange their lives. Keep in mind, Also, and, you know, as we prioritize activities, that children, especially elementary age children and younger, continue to need and thrive during unstructured play, including solo play and playtime with friends. So sacrificing playtime, which they've had a lot of, hopefully, over this past year, for a relentless schedule of scheduled activities, structured activities, really robs young children of opportunities that free play provides. So free play provides an opportunity to naturally develop creativity, manage boredom, and work through conflict and difficult emotions. So making sure that families are, as they get into a new routine, are considering, when do our kids have time to maintain that unstructured play that they've really been able, hopefully, to have over this past year, is going to be really important. And while structured and scheduled activities such as team sports and extracurricular activities provide a lot of meaning and skill building for adolescents, they also need unstructured and unscheduled time with peers and family that still encourages fostering interests and healthy peer relationships. So, you know, it's okay to have just some time that you're hanging out with friends or doing unstructured activities with families. So as I said, a lot of the patients that are coming in to see me, especially this summer and at the end of last spring, were coming in with anxiety about re-engaging. And so when children express anxiety about re-engaging in activities, including social situations, providers, parents can remind them really of the resilience that they've shown over this past year. I haven't worked with a single child or family that hasn't demonstrated some level of resiliency. And so helping kids kind of name and give examples of challenges that they faced, including challenges that they had prior to the pandemic that they were able to face, even though they may have felt a little bit trepidatious or anxious before doing that activity, reminding them that they've done this before and that you have a lot of confidence in their ability to do it again. Small incremental goals can help children and adolescents and adults too feel like we have more control over situations or challenges that can be really overwhelming. You know, I worked with a lot of kids with social anxiety over the past year who in some ways would say that they're living their best life. And because they weren't seeing peers. And actually from a treatment perspective, for me, I really felt like their social anxiety was just stalled in the water, because prolonged avoidance serves to heighten anxiety and lessen confidence versus relieve anxiety. And so that gradual exposure plan is really important for kids and adolescents to help ease them back into social settings, because it's not about avoiding society. It's about learning how to cope with anxiety when you're with peers, when you're doing classroom presentations, when you're in a public restaurant needing to order for yourself, those kind of things. So, you know, kids really need to hear caregivers say, I know that you're worried and I feel confident in your ability to cope. So really offering support over accommodating. So it's not uncommon that parents respond to kids' high anxiety with accommodation. So, okay, I'll order for you in this restaurant, or you don't have to go out, you don't have to go home. You don't have to go over to a friend's house. Certainly, I worked with families who chose to keep their kids at home because of their when school went back in person, because of a child's anxiety about returning. And now they face returning in the fall in person without the option of doing online instruction, and they're really struggling to figure out how to make sure they can switch from accommodating to support. Decades of research on effective parenting have shown that kids thrive best with caretakers who provide high levels of structure and nurturing. Both are essential ingredients for helping kids navigate anxiety, along with difficult emotion and confidence. or with confidence. So it's really important that you can remind parents that, you know, sometimes you'll have parents in your office that seem to be high on nurturing and low on structure. Sometimes you have parents that are high on structure and low on nurturing. And it's really about finding that balance when it comes to helping kids be resilient and navigate things emotionally. So when do you know, when do you know when additional support is needed? So, you know, for many kids and adolescents, natural supports alone are going to be exactly what they need to navigate the coming months. But for some, natural supports may not be enough to help them manage. So what you might be looking for in your practice is impaired daily functioning at home and school and extracurricular activities, significant disruption in sleeping and or eating, persistent problems with relationships, a drastic and prolonged change in mood or behavior, increased isolation and decreased engagement with school, family, and peers. That includes electronic means. So of course, I have a lot of families coming to me and saying, oh, my teenager spends all of their time in their room, not wanting to be with us. And it's, you know, to a certain extent, it's normal that teenagers like to have their own space. And if you think of kind of, we all need a room of our own, that room for them may have served as a significant sanctuary during a really difficult year. But if they're in their rooms and they're talking to friends, either through video games or text message or FaceTime, then in some ways they are continuing to remain socially connected. But if you're hearing from your patients that they are isolating in their rooms and not connecting with peers at all, that could be an indication that more follow-up is needed. Of course, evidence of substance abuse would be a warning sign that they need additional support. And then persistent somatic complaints, including headache and GI concerns that are unexplained. If these symptoms worsen or persist, of course, you want to reinforce the stress management strategies that I just covered, but also you'll want to proceed with further evaluation and treatment planning with behavioral health providers. So how do we talk to parents, caregivers, patients about helping connect them with support or giving their kids extra support during this time? I think it's really important that we normalize the impact of COVID-19 in addition to structural inequities. I don't think that there's been a single intake that I've had in the past 12 months. If it's a family that lives in Louisville particularly, which is, you know, most of my patients, where I do not talk about not only the impact of COVID-19, but the impact of structural racism. I think that if we think that only Black and brown teenagers and kids are impacted by this, we are overlooking how white teenagers are also impacted by systemic racism. So really making sure that we're spending time talking about the impact and normalizing this impact over, you know, when we're talking to parents even, is really important. Reminding parents that a child and adolescent's behavior, particularly when they come in with really disruptive behaviors, is a manifestation of their emotions, because behaviors and emotions are closely linked. In fact, we really can't separate them often. So helping a child and parents find healthy ways to express emotions can often improve their behavior. Normalize the process of help seeking. You know, seeking mental health treatment, there's a stigma around mental health treatment in many communities. So letting parents know that you want to collaborate with a behavioral health specialist that can work with you as the primary care provider and the family to successfully help the patients. As primary care physicians, You know, those of you who are attending today that serve that role, you have a really wonderful and beautiful opportunity as someone who's had a lifelong relationship with this family to help normalize these types of services and, you know, using the trust that you've established with this family. So, of course, offering to follow up again after you've referred them to a behavioral health specialist, checking in, seeing how their child's doing, and helping ensure that they got the help that they needed. You know, on that note, there's been such a increased demand for mental health services over this past year. I think if you've tried to refer a patient either within, you know, if you're a Norton provider, if you've tried to refer them within our own system or outside the system, or if you're, you know, in the community referring to other community-based providers, you've encountered that there's a, you know, significant demand for mental health services, which also means long wait times and wait lists. So the need to access quality behavioral health care is so essential now more than ever. So encouraging your employees, whether that be Norton or other agencies and groups that you work for, to build partnerships with community mental health providers and supporting integration of behavioral health services into service lines is really essential now more than ever. I think all of you would probably agree that this has been a need that you've had in your practices for many, many years. And if we, you know, we're really dealing with what I think are going to be lasting mental health impacts in our community from this year that we're coming out on. And if we don't have the support in place within our own practices to support our patients, then it's only gonna lead to issues in adulthood. I mean, and that's why I would guess all of you work in primary care or with pediatrics. That certainly is why I work with kids, is that I know that if we can intervene with children and adolescents, we really have a unique opportunity to prevent more negative outcomes in adulthood. And so making sure that we prioritize access to quality mental health care is so important. All right, so I believe that you'll be able to ask questions of me in the chat. I'm gonna come back to me. Let's see if I can get it
All right.
going. Okay, so you should be able to see me now, but I did include in my presentation, if you have access to my slides, my email address if you'd like to reach me that way, as well as some information about how, you know, community referral resources here in Louisville, some important mental health hotlines that you can provide for your patients and families, along with some additional resources for providers. So I really appreciate the opportunity to present today. I really hope that it gave you some food for thought about thinking about how you can help your patients and their families redefine what their new normal is going to be as we reemerge from this remarkable year.